Hi, my name's Travis Pearson. I'm uploading my first video journal, unit number 1. My first thing, I need to describe my past experiences with mental health or with mental illness. So, when I grew up as a kid, my dad owned a res care facility that was used to treat very mentally ill patients, lots of schizophrenics, lots of bipolar patients. I didn't know that yelling at inanimate objects was a big deal till I got a little older, and then I kind of got away from that. And then a few years ago, I decided to go back to school and became a registered nurse. And then I went into the psychiatric side of things and have been there ever since because I really love dealing with the patients, seeing how well they progress, watching them do well, and unfortunately repeat the whole cycle again. The reason I have chose to work with this particular population is this is the hardest type of medicine because unfortunately there is no cure. We don't bring people back from schizophrenia. We just try to get them to a baseline level where they can partially function in the world. A lot of the bipolar patients we can help with depending on if they take their medication or not. And I really like working with the younger adults, like the 18 to 21-year-old kids that just need that extra reassurance in life, and they just haven't had some of the experiences that other generations have had. So I like working with that particular group where they can experience a lot more things and kind of teach them a little bit more resiliency in this world. Discuss any concerns you have regarding this clinical. I have not started my clinical. It starts on Monday. I have a lot of reservations, even though I've been working with doctors and nurse practitioners in the inpatient setting for the last 4 years. This will be the first time I've ever worked in an outpatient setting, so it'll be a lot interesting working with medications that I've never got to play with. In the inpatient setting, pretty much all we get to work with is generics, so getting to work with some of the different medications out there sounds like fun. I mean, prescribing Valar to some of these patients, or just different medications that I can work with. Identify personal or academic professional goals you have for this clinic. I just want to learn as much as I can. I am hoping to get a job after I get done with this school, so this is kind of good practice for me. Interviewing, seeing my skills, see how well I fit into an outpatient setting. I'm also looking at jobs in the inpatient setting just because that's what my background is. And that's about all I have. I appreciate all the opportunity to work with this, and thank you very much.